हेलो नमस्कार 92.7 बिग एफएम से मैं हूँ कानपुर की ईमानदार लड़की आरजू नीलांशी। और आज हम आपके लिए एक स्पेशल आईवीएफ अवेयरनेस सेगमेंट लाए हैं और हम खास बातचीत करने वाले हैं उनसे जिन्होंने अपनी लाइफ डेडिकेट की है इंडिविजुअल्स एंड कपल्स की लाइफ को हैप्पी बनाने में, उनकी जर्नी स्टार्ट करने में टुवर्ड्स पेरेंटहुड। और हमारे साथ आज मौजूद है, प्लीज एवरीबॉडी वेलकम डॉक्टर इला गुप्ता जी, जो है एमएस इन गायनेकोलॉजिस्ट एंड obstetrics. Am I pronouncing it right, ma'am?
Yeah.
Yeah, thank you. And diploma in IVF and reproduction medicine and diploma in endoscopy. और अभी वो fertility clinics दिल्ली में है कार्यरत. Hello, ma'am. Welcome to our show. How are you?
Thank you so much for the kind words, Lakshya. I am good, and I am here to solve few of the queries, myths, and facts of the people. I think there are some myths related to IVF, and they think it's like painful and too costly. The success rate is low. So we're here to discuss all this.
आज हम ये जो आईवीएफ अवेयरनेस सेगमेंट लाए हैं, इसमें हम लोग करने वाले हैं खास बातचीत। मेरे सवाल हैं तैयार आपके लिए और हम फिर से बता देते हैं कि हैशटैग स्टार्ट योर जॉय, दिस इनिशिएटिव हैज बीन ब्रॉट यू बाय भारत सीरम एंड वैक्सीन्स। तो मैम, मेरा पहला सवाल आपसे ये है कि इनफर्टिलिटी क्या है एंड हाउ मच कॉमन इट इज अमंग कपल्स दीस डेज। इतना कॉमन क्यों है?
See, infertility is a problem when the people, they are trying for pregnancy and still the pregnancy is not happening. So now this definition of infertility is when the couple is together for 1 year and still the pregnancy has not happened. They have not achieved the pregnancy. Then we label them as subfertility or infertile. And it is at that stage they should seek the advice of the fertility specialist. And if the female partner is of 35 years of age, then it's better not to wait for 1 year. Then they should seek the advice within 6 months only.
Acha.
And it has become common.
Yes.
Yeah. These days, if you see, like 1 in every 10 couple is suffering from infertility. It is so common. And it may be because of the lifestyle these days. The stress factor is too much. Then they don't have time for each other. Both partners are working, their job profiles. There are many reasons why the infertility is increasing.
Okay. मैं मेरा अगला सवाल आपसे यही जाता है कि what are the major causes for infertility in both men and women, and are there any treatment options available?
Yeah, see, in female partners, it's a 30%. The reason may be the fallopian tubes, either they are not healthy or they are blocked, or they are not forming eggs at the right time. There may be problem in the egg formation, or there may be some problem in the uterus. Maybe the congenital defect, or they are not developing the good lining of the uterus, which we say the endometrium. Sometimes in males, there can be problem like sexual dysfunction. They are unable to perform. There may be ejaculation problem or the erection problem. Then there may be subnormal sperm count and motility. Okay. So which may also result into infertility. In 30% of the cases, you'll see the male infertility. In 30%, you'll see the female infertility. Then in few cases will be there when it's combined. Both partners, the male partner and the female partner having problem. Or in 30%, if you see, it is unexplained infertility. Now, unexplained infertility means when we do the test, the basic test all comes out to be normal. Like the semen parameters, the sperm count, motility is normal. The female partner is also forming egg at the right time. The tubes are also normal. They are not blocked. Still, the patient is not conceiving. Okay. So those cases, they come under unexplained infertility.
Acha.
Yeah.
And what are the treatment options available?
Based on the age and the duration which they have been trying for pregnancy, then on the ovarian reserve, the blood test AMH, which tells us what is the ovarian reserve of that particular female, then the semen parameters, we decide, and the cause of infertility, we decide what option we should give the patient to have the maximum chance. So first step is the IUI, that is intrauterine insemination. Okay. So intrauterine insemination is a very simple procedure, OPD based, and here the semen sample is prepared, it is centrifuged, and it is placed inside the uterus of the women when it she is ready to ovulate, when the egg release, around the time of the egg release. So there is no admission, hospital admission, no overnight stay, no any precautionary measures or nothing like they have to follow after the IUI cycle. So they can continue their work as they are doing. They can continue with all their routine physical activities. So, and if IUI does not succeed, or if there is any problem in the tubes, unexplained infertility, or if there's a problem in the male partner when the count and motility is compromised, or they have been trying IUI and still the pregnancy is not happening, then they advise to go for IVF.
ओके मैम, जो अगला सवाल आता है वो यही आता है कि जो आईवीएफ है उसका जो स्टेप्स है या प्रोसेस है वो सरल भाषा में अगर आप बता सकें, और ये ART क्या चीज है?
The ART means assisted reproductive technologies.
Okay.
Okay, so IVF is the first conventional term. We call it as IVF or the test tube baby because people understand IVF, the term IVF. One step ahead of IVF is ICSI, ICSI, that is intracytoplasmic sperm injection. So now most of the centers, they are doing ICSI. IVF is the old conventional term. Okay, so nowadays it is the ICSI, but because the people understand IVF, so we say IVF. Okay, ICSI is one step ahead of IVF. The preparation of the patient is same as for IVF. So preparation means like if the patient has to come from abroad or from other state, then we call them like 3-4 days before the cycle starts. So that during those 3-4 days, we get all the tests done, the basic tests to see whether that both the partners, they are fit to carry the pregnancy. And depending upon the cause of the infertility, accordingly, the plan is made. Okay, then we wait for the cycle to start because this treatment is cycle related. So from day 2 or day 3 of the cycle, the injections, they are the hormonal injections which are started. And roughly the patient receives these injections for 9 to 10 days. And during this time, the follicles get ready. In between, we ask them to come for the ultrasound to see how they are responding to the injections. Kitne follicles ban rahe hain, what is the hormone level, lining of the uterus kaisi ban rahi hai. So in between, we call them for follicular monitoring. So on an average, there are like 3 to 4 follicular monitorings when they take the injection. Okay, so roughly 9 to 10 days injections. By the time the follicle size reaches 17 to 18 millimeters. So when this follicles reaches 17 to 18 millimeter in size, we do the hormone test, and if the hormone test is also okay, then they are given one last injection, final injection that we called as the trigger injection. So that the eggs inside the developing follicle, they get mature. And after 36 hours of this final injection, we take the eggs out. So this, when we take the eggs out, that day the patient has to come empty stomach because this procedure is done under anesthesia. It is done under general anesthesia. So patient is comfortable. There is no pain. And this procedure is done under ultrasound guidance. And it is done vaginally, like we do the internal ultrasound, like we do the transvaginal ultrasound. So there is no cut, no stitch. And this procedure roughly takes like 15-20 minutes. And then 1.5 hours to 2 hours of the procedure, they can go back home. So there is no overnight stay. It's only a daycare procedure. And same day, the partner is asked to give the semen sample. That semen sample is also centrifuged. It is prepared. And then the sperms are selected. And they are injected inside the egg of the female partner. So because they're injected, one sperm injected inside one egg. So that's why it is known as intracytoplasmic sperm injection. And this ICSI procedure, in short, we call it as ICSI. So this ICSI procedure is done to enhance the number of fertilized eggs. Okay. So we have enough number of embryos. And this ICSI procedure is also advisable for those couples where the male partner has severe low count and motility, or where the sperms are taken directly from the testes, or in cases where the female partner has few number of eggs only.
Okay.
So there the question comes whether anything will fertilize on their own or not
That
if we
was
do the
my
IVF.
that was my next question. What is the success ratio of having an IVF, and what are the factors which influence its success ratio?
The success rate, it depends on many factors. This is the first question which the patient invariably asks. What is my success rate? What is the success rate of IVF? So it's a very subjective thing. Like if you see the overall data in the record, the success rate, we say it's not more than 55%. But there are now many new techniques which have come up to improve the success rate.
Acha.
So those newer techniques, when combined with this procedure, the IVF-XC procedure, then the success rate goes up to 75 to 80%.
Mm-hmm.
Okay. And this success rate, it varies from individual to individual. Acha. The most important is the age of the female partner.
Okay.
Now we know the female partner age is very important. As the age advances, the fertility starts reducing. And there is a drastic reduction in infertility after the age of 35 years. This is because the number of the eggs, the reserve starts going down. And it is not only the number, the quality of the egg, the genetic material starts changing, and that also starts deteriorating. Okay. So that's why the female partner age is important. We always advise them, as soon as they come to know that IVF is the only option, go ahead, don't waste time. Then it depends on the cause of infertility. The success rate. Then how many number of eggs we have? How many number of embryos are there? What is the quality? What is the quality of the sperm which we have received? What is the morphology of the sperm? The shape of the sperm? And then the endometrial factor. The lining of the uterus, which is important, where the pregnancy has to implant. And obesity. Yes. Obesity is a big factor. The sedentary lifestyle, there's no physical activity. Okay. So all these are the important parameters which affects the success rate. Yeah.
अगर मैम लाइफस्टाइल चेंजेस लाई जाएं तो क्या उससे फर्टिलिटी सही हो सकती है, थोड़ी भी चांसेस बढ़ते हैं, और आईवीएफ के सक्सेस होने के भी चांसेस बढ़ते हैं अगर लाइफस्टाइल चेंज लोगों ने?
Definitely yes. That is the first most important counseling from our side to the patient at every visit. Okay. The lifestyle. Because lifestyle today it's very, very different, which we used to have like 10, 15 or 20 years back.
Yes, ma'am. We are totally dependent on instant
The optimum weight.
Yes.
Is very important. She should not be too thin and she should not be on the obese side. Okay. So the weight has to be optimum. BMI has to be optimum. The regular physical activity, which can be in any form, regular exercise. Give yourself 40-45 minutes along with yoga and meditation. Because this yoga, meditation, exercise, if you have heard about it, releases the positive hormones, which keeps you happy, which keeps you positive, and it de-stresses you also. Engage in some kind of activity which keeps you happy, like music, dance, any sport activity, which is important. Yeah. Then for the youngsters especially, they avoid smoking and alcohol. Especially the smoking for both partners, for the female partner and male partner, because it affects the gametes. Yeah. It affects the quality of egg in the sperm. So that is very, very important. Then to have healthy, well-balanced diet. Avoid junk food, avoid processed food. That is very important. Because I see the couples, they have hardly any time to go to the kitchen. For them, it's easier to have the sandwich. For them, it's easier to have the prepared meal outside in their office, because both partners are working. And sometimes they have to leave for the office early. They're coming back late. So sometimes they're skipping breakfast. Sometimes they're skipping
their lunch, their breakfast. Yes.
Yes. And then they're having their dinner very late. So that is also very important. If you have your dinner at 10:30, 11, when are you going to go for sleep? Another important thing is the sleep. The sleep time is very important. At least 8 hours sleep. Sound sleep is very, very important.
Sounds lifestyle really tough, for today's generation to follow that. It sounds really tough. I can totally relate to it. It sounds, there's so much work pressure is also there. There's self-imposed pressure is also there. So I
social
totally
pressure.
understand. Yeah,
Social pressure.
that is also there. Like even if you're performing well, your peer is performing
Yeah.
very well than you, your managers are sitting more time than you have to give in that. And चाहे private sector हो चाहे public sector हो, हर जगह उस level का काम करना ही पड़ेगा अब आपको. So there is
Yeah,
no
they stop,
reality.
sometimes because of this social pressure, they stop meeting people. They
Yeah,
stop meeting friends and the family members.
exactly.
The sharing is very important, and the family should also understand what they are going through.
Yes.
The support from the family is also equally important.
Those were the times when everybody used to be
Yeah.
so intimate and live together. Now
Yes.
everybody's
Yeah.
nuclear separated and aloof. So
Yeah.
वो communication gap है. मतलब you know the family भी पहले होते थे साथ में तो बच्चे पल जाते थे.
पल जाते
पता
थे.
भी नहीं चलता था. And now you're troubled. You like first you have to think कि how you will arrange. आया कहाँ से आएंगी, caretaker nanny कहाँ से आएंगी. So there's so
Now
many
the problem
questions.
is they don't have time for themselves.
Yeah,
So
that's the
this
question.
is the liability like having kids, and especially when it is not happening easily.
Yeah, exactly. They're thinking over it. कि
Yes.
करें कि ना करें.
Correct,
Okay,
correct.
that's well explained, ma'am. My next question goes to you, ma'am. कि fertility के और भी कोई alternative options हैं क्या other than IVF? If you could suggest some.
Beside IVF for the
जी
fertility, I mean to say.
जी जी.
See, there are some indications for IVF. Then only one go for IVF.
Okay.
Otherwise, as I told you, we
हाँ.
always try gives if the patient is young, if all the reports are normal, we give them some time to try naturally.
हाँ.
We tell them this is your fertile period, so be together. Go for some vacation during your fertile period. Okay, otherwise it all becomes mechanical. Okay, when they're coming to us, we are doing the ultrasound, we are doing the follicular monitoring. Okay, today the size is this, so you come day after. So then the size is this, you have ovulated, now you try. Okay, so the thing should not become mechanical. So when it is not happening naturally, then only you move one step ahead, and that is IUI, as we discussed.
Yes,
but when IUI also fails, definitely then there is some problem. That's why it's not happening inside the body. Then you move on for IVF.
Uh-huh.
Yeah.
Totally get it. Okay. But what are the environmental factors that could affect fertility of people? Environmental. Now, outside word say, अगर हम लोगों को effect मिले तो, I would feel pollution could be the one, if I say so. Is it so? Could be an option.
That is also the part of our system only, na? The environment, pollution, what we are eating.
Exactly.
Like if I say I eat very healthy diet, okay, all the green vegetables, all the fruits, but how do you know even the dairy products? That how much real they are, how they are prepared, how do you know? So that is very, very important. Then all the gadgets, electronics which we are using, we cannot keep ourselves away from them, because we have to have the mobile, the laptop most of the time.
Until we sleep, we do have it by our side.
Yeah.
Yes. And food we are eating के also जब उनकी तैयारी होती है तो कितने सारे खाद पड़ती हैं, fertilizers पड़ते हैं, तो उससे
yes, the fertilizers, chemicals.
Yes.
Now all those like watermelon, they are injected with the sweeteners. So they are all artificials. Even the ghee, the Loki which we eat, the oxytocin injections are given.
Yes, to make it bigger.
To make it bigger.
Yes.
Okay.
Yes.
Earlier, if you see the years back, there used to be the
seasonal
seasonal vegetables.
Yes,
seasonal vegetables and the seasonal fruit. Now all the vegetables and the fruits are available all the time.
All the time. You have
all
like
the time.
every...
So from where are they coming? From where are they coming?
We are developing it over a period.
Yeah. So you cannot escape from all these things.
Yeah.
What all are you going to stop eating?
हम millennials ने तो मैं तब भी एक journey cross कर ली है, but think about the next generation which is coming. What are they going to have? I just worry.
The time is difficult, actually.
It's very difficult. If technology is growing, fooding, the dedication our parents, the time our parents have spent with us, वो जो attachment, now I don't think so they would get it, because everybody is so occupied. Yes. Ma'am, my next questions to you is, आप क्या मैसेज देना चाहेंगी उन कपल्स को जो अपनी पेरेंटहुड जर्नी शुरू करना चाह रहे हैं IVF के द्वारा? क्या मैसेज होगा आपका?
See, for the couples who not only for IVF, when they have started planning for pregnancy, okay, and if it is not happening, the stress should not be there. It's very easy to say stress should not be there, but I can understand. Then the pressure starts from every side. Exactly. So, but then you should know how to cope up with that stress. That is very, very important. How to cope up. You cannot escape from all these things, but exactly. How to answer them and how to cope up with the stress factor. So for that, again, the lifestyle, the regular exercise, which keeps you going, which keeps you happy, which produces the positive hormones inside the body. Keep yourself engaged. If you're not working, then how are you going to keep on thinking about that only all the time? So keep yourself engaged. Engage in some kind of the activity which keeps you happy. Avoid smoking and alcohol. So these are basically it's all the lifestyle. And even if they're not getting time to do exercise, they can go for a walk. Does walk count? Simple for walk, or have early dinner. At least give 2 hours a gap between the dinner and the sleep time. Have proper sleep. Have good sleep. That is very, very important. See, you have to take some time for yourself. Yeah. If you don't have time for yourself, then it's very difficult to manage. So they should be in 24 hours, there should be some time for yourself. Some me time is very important. And especially for the youngsters, to avoid smoking, alcohol, to keep your weight under control, and to have safe sex or use some precautions, contraception. Okay. Avoid having going for the abortions. Because when you go for the abortions, there is a risk of infection inside the body, and that may also sometimes damage the tube, and it also has a psychological impact. Totally agree, ma'am. So that is very, very important. Yes. And thank you so much, Dr. Ila, sharing such a informative stuff with us. और I hope कि आपने जितनी बातें बताई इतने अच्छे से explain की मेरे सारे viewers को बहुत चीजें समझ में आई होंगी. Because hashtag start your journey today. This initiative has been brought to you by Bharat Serum and Vaccines. And ma'am एक चीज पूछना चाहेंगे, miracles होते हैं ना? Miracles happen? बिल्कुल, बिल्कुल. Sometimes we tell the patient, your embryos are not that healthy. So please don't be very hopeful. And sometimes those patients come positive with the pregnancy. Wow. We have seen miracles. When the lining is not good, it is only 5 millimeters, 6 millimeter. Those patients come with the pregnancy. Wow. And they deliver a healthy baby. Very nice. So be hopeful, be positive, be prepared for everything. The only important thing is keep going with the flow. Yeah. तो स्वस्थ रहिए, मस्त रहिए, अपना ख्याल रखिए. Being hopeful is very important. Yes. The miracles do happen. हैप्पीनेस रखिए और जो अपनी जर्नी है उस पे बिल्कुल फ्लो के साथ जाते रहिए और होपफुलनेस रखिए क्योंकि मिरेकल ऑलवेज हैपन ईमानदारी से. So thank you so much, doctor, for such an insightful talk. Thank you so much. This is Arjun Nilanshi from 92.7 Big FM. Dhun badai to dekho. Thank you so much, ma'am. And hashtag start your journey today. This initiative has been brought to you by Bharat Serum and Vaccines. Thank you so much, ma'am. Thank you. Have a great day, ma'am. Thank you very much. You too. Thank you. 92